My name is Dr. Jerry Bagel. I am the director of the Eczema Center of New Jersey in East Windsor, New Jersey. I'm also a clinical professor of dermatology at Mount Sinai School of Medicine in New York. Here at Windsor Dermatology, we take care of thousands of patients with eczema. We've been doing this for over 35 years. And in fact, we do many clinical trials to help find better, more effective treatments for people with atopic dermatitis. Eczema is a very common skin disorder that can affect children, adolescents, as well as adults. The hallmark of eczema is itching. Itching almost always precedes the rash, but the rash can exist on the face, the arms, the legs, or all over the entire body. That kind of says what it is, but what causes it? What causes eczema is there's an immunologic deficiency in your skin. In fact, certain white blood cells are producing too much chemicals that make your epidermis break down. It's like there's fluid in between the cells, and because of that, you're losing hydration, and also allergens are able to percolate into your skin, causing inflammation. So what you have in eczema is an inflammation of the skin. Eczema is associated with asthma, allergic rhinitis, and conjunctivitis, and food allergies. So eczema is not just a disease unto itself, but it's part of what atopic dermatitis is and what's known as the atopic march, where you can have eczema and then develop asthma and then develop food allergies and then develop contact dermatitis. So it's a continuum of disorders that individuals have. But going back to what causes it, is that there can be a breakdown in some of the protein within the upper layer of the skin in the epidermis that allows for what's known as spongiosis, which is like fluid in between the epidermal cells that allow for a lot of congestion and itching and inflammation. Eczema can be all over the body, but it is not contagious. Most commonly, children have eczema. About 5 to 6% of the children in the United States have eczema, and they can get it at the age of 2 months, 3 months, 4 months, and have severe cases of it through their early life. Fortunately, in about 40% of all cases, by the time people are 10 years old, the eczema goes away. For some reason, the epidermis changes, the immune system changes in these individuals, and they're no longer susceptible to eczema. But in those individuals that don't outgrow it, they tend to have a more serious case of eczema. And because of that, they itch more, they scratch more, and there's a term called lichenification, where after a lot of scratching and itching and scratching, the skin becomes thicker, and you almost seem like these new lines on your skin that are making it very difficult for you to stop scratching. So it can become much more difficult to treat as we get older. Treatments clearly depend upon the severity of the disease. What we like to do is go with very basic treatment to start. Avoid hot water in the shower. Use lukewarm water. Use mild soap like Dove. Pat dry gently when you get out of the shower. Apply a moisturizer cream immediately after getting out of the shower. So that's basic treatment. Other treatments then become, we could use topical therapy. Creams, ointments usually work better than creams because they absorb better. We can use topical steroids or non-steroids like tacrolimus that can really help people with their inflammation. So topical therapies can help. Beyond that, if topical therapies are not helping, then we can use phototherapy, ultraviolet light. And ultraviolet light, increasing doses 2 to 3 times a week can help decrease the inflammation in the skin. That can be very beneficial and is very safe. Beyond that, the next treatments really is something we helped develop here about 4 years ago called Dupixent, which is a biologic agent that helps modify some of the T cells so that they're not producing as much IgE, which makes you itch. And by doing that, it works about 80% of the time. It is relatively safe. If you know that you have eczema, if you already have that diagnosis, yeah, I think it's fair to utilize moisturizer creams twice a day, avoid hot water in the shower, and see over a week or so if that's going to help you. But if you see that it's really chronic, persistent itching, then it's best for you to get taken care of so it doesn't get to the point that it makes it more difficult to treat. I want people with eczema to know that this is the age of eczema treatment. The 2020s is when we are starting to develop new medications for eczema, just like the last 10 years was the era of psoriasis treatment. Now we're developing really good, effective, safe medications for the treatment of eczema, and don't deny yourself the treatment options, because some of these treatment options are actually FDA approved down to the age of 6 years old. That's how safe they are. So therefore, do not deny yourself the opportunity of good treatment. It's available. Treating eczema is challenging because patients are itching so much that they can't even stand still. And if you look at children with eczema, there's an increase in ADD in kids with eczema because they're like always moving around because they're itching. So trying to get people to stop itching is a challenge because we don't really have great medications for that right now. I mean, we have topical steroids that get rid of inflammation, and we have antihistamines that'll make you sleep, but none of them stop itching. And we're actually in the process of developing new medications to just stop itching, but they're not working that well yet. They only work like 30% of the time. We're like in the infantile development research for anti-itch medicine that won't make you sleep. So that's, I think, one of the most difficult parts of eczema, in addition to the fact that it's chronic. And here's what else is very unique about eczema. It's capricious. It waxes and wanes. Like, we could be looking at a patient to enter into a clinical trial, and they could come in one day to kind of be evaluated, and they can have 20% of their body involved with eczema, and they can come back 3 weeks later to enroll in the study, and they can have 35% of their body involved in eczema. So it can really wax and wane, and a lot of it has to do with stress. So I think that the capricious nature of the disease, that it can be sometimes not so bad and a few weeks later terrible, it's very difficult to treat, and you can't really treat this effectively with topical therapy. It's not great. So until now, we haven't had really effective treatments for atopic dermatitis. Some of the more difficult aspects of atopic dermatitis is when kids get infected, and it's easy to treat, but they get impetiginized. They get like honeycomb crusted lesions on their body. And it's really very easy to treat. You get like 2 tablespoons of Clorox and you put it in the bathtub and you soak them for about 10-15 minutes twice a week. And it's called bleach bath soaks, and it helps get rid of their staph infection. But those are things that make it difficult to treat, and they become very itchy. Rarely also, if somebody got a fever blister with eczema and it starts spreading, it's called eczema herpeticum, that can be serious. So that needs to be treated with oral antiviral medications. There's clearly an increased frequency of depression and anxiety in people that have atopic dermatitis. People with eczema are worried that they're going to be scratching in public, that they're going to be distracted, that they're going to be humiliated because their skin looks different. I mean, it can be like really red. They can have, I had a patient today with just red face right in the center of the face. I mean, there's no way no one's not going to recognize this as being abnormal and wonder, what do you have? They don't know it's eczema. They don't know it's not contagious. They don't know what this is. So they have a lot of impairment in their self-esteem. They have a lot more being self-conscious and a lot of more isolation than the person that doesn't have eczema. At Windsor Dermatology, we've been doing research with clinical trials with our patients for atopic dermatitis for over 30 years. We've helped develop topical medicines, oral medicines, and biologic medicines. We are at the forefront of treatment of people with atopic dermatitis, so even if the current treatments don't work, we have newer medications that we can utilize before they become FDA approved to help people that are having chronic disease.